Hello, hello. Thank you for coming to Ask Dr. Kelly OMD this evening. It's Monday night, so 7:30 p.m. Eastern. That's where we are every time. Our goal here in the Viva Life Health Hub is to educate, inspire 1 million women and their families to live their healthiest and wealthiest life. And the way that we do that is through the Viva Life 5, which is meditation, journaling, nutrition, and our sleep. We eat the Viva Life 5 foods, which are fruits, vegetables, beans, nuts, grains, and drink lots of water. And we bring on these subject matter experts in their field to talk about resources and tools that you could use in order to prevent or save your life. That being said, we have Dr. Denise Whitfield. She's going to introduce herself and we're going to get started. Go ahead, Dr. Denise, take it away.
All right, thank you so much. I'm Dr. Denise Whitfield. I am a board-certified emergency medicine physician, as well as board-certified in emergency medical services, or EMS. I work full-time as the soon-to-be assistant medical director in Los Angeles County for the EMS system. I was also in the Navy for 12 years. My final job, I was a White House physician during the Obama administration. And so after the Navy, decided to see what civilian life had to offer me. So I'm settled here in Los Angeles County now.
So just amazing. So wait a second. Emergency is no joke. Veteran, 12 years in the United States Navy, and a White House physician. Come on, y'all. Who brings it to you like this? So Dr. Whitfield, what are we talking about today, and what are the top 3 things you want us to take away from your discussion?
Yes. So today I would like to talk about the importance of bystander CPR. And so number one, I want people to know that it is easy to do and that anyone can do it and play their role in saving a life. 2, I would like to know everyone to know how to recognize a patient in cardiac arrest and when to start CPR. And then 3, I'd like to highlight that there are a number of disparities in who receives CPR. And so part of educating everyone today is so that they know what to do. And so that I know that if you find a person in cardiac arrest, you'll be able to give CPR and help to close that disparity gap.
Awesome. Well, go ahead. Let's get started because hear all about this. We all know that people can unfortunately have a sudden cardiac arrest on the football field or on the basketball court. We've seen that, but what about in your home or maybe even at your job? So tell us all about this.
Yes, so just talking about CPR. So I actually had the occasion, it was about a month ago. It was my first time doing bystander CPR outside of a hospital. And so I was actually on a work trip. I was at the airport in North Carolina. As soon as I got out of my ride share, I heard someone yell, "I need help. Can someone help me?" I walked over and there was a woman. She knew how to do CPR. She was doing chest compressions, but she said, "I need someone to call 911. Can you help me?" And so we activated 911 right away. I switched off with her. I identified myself as a physician. She was actually a nurse. And so we switched off giving CPR to this gentleman. And he was able to get a pulse back before transport to the hospital. So good outcome there. And so I really think that anyone can do it. And I would like to hope that if that were to happen to me, that someone would do that. And I think we both had a good feeling that we were able to help someone. And so when we think about cardiac arrest, what does that mean? It's a broad term. And I think for the average person, there's some confusion. And so it's really a general term that it means that your heart suddenly stops beating. The underlying reason can be a number of causes. But what happens when that happens is that your body is no longer getting blood circulated. So you're not getting oxygen to the brain, your vital organs, things of that nature. And then goes long enough, you'll eventually die. And so what really matters is what we call the chain of survival. And every link in that chain has a really big impact on the final outcome for that patient. So what's the likelihood that they're going to survive that cardiac arrest? And if they do survive, what will be their function, like their neurological function? Are they going to be like they were before the cardiac arrest? And so when we talk about this chain of survival, the first step is activating emergency response by calling 911. But the second thing is receiving high quality CPR. And so that's really important because we actually have recognized that there are a number of disparities in who receive CPR. Number one, women, they've done surveys and people have reported that they are less comfortable performing CPR if that patient that has gone into cardiac arrest in the field is a woman. And that has a lot of like cultural contributions. Sometimes average person, they may be intimidated about putting their hands on a woman's chest, but the outcome for that woman is that they wouldn't have received that second link in the chain of getting high quality CPR. We've also noted ethnicity disparities as well. And so there was a study published in the New England Journal of Medicine, which is a really big medical journal in our country. So they looked at database information where they looked at over 35,000 cardiac arrests over a 6-year period and out of hospital, but these were all witnessed. So someone actually saw this person collapse. And they found that Black and Hispanic persons, they were less likely than white persons to receive bystander CPR. And that was regardless of the racial or ethnic makeup of the neighborhood or the income of the level of the neighborhood where that cardiac arrest occurred. And so the reason why that happens, we don't know, but that disparity exists. And so it's really important that everyone knows how to do bystander CPR and how to recognize that person that's in cardiac arrest. And so what I'd like to talk about today is just CPR and what to do. And it's actually very simple. The current data, they recommend hands-only CPR for the average layperson. Now, if you're a medical person, there's conventional CPR that a lot of us may have learned or heard about, where you're doing a certain number of compressions and then you do mouth-to-mouth resuscitation or some type of ventilation. But in about 2008, the American Heart Association thought that that actually produced a lot of barriers to people actually performing CPR because it was intimidating in some ways. People would think, well, how many compressions, how many breaths, am I doing it wrong? And then what people would do was nothing. And so the person wouldn't get any CPR at all because people were afraid of doing the wrong step or the wrong number. And so around that time, they came up with compression only, or what's called hands only CPR. And so the steps with that, there's only two. The first is to call 911, and the second is to push hard and fast in the center of the chest. And so the person that you want to identify as being in cardiac arrest, that is an unresponsive person. You go, are you okay? They're not responsive. Are they breathing? If that person is not breathing, or they're just having gasping type breaths, but they're not breathing normally, start CPR is really the take-home message. And so with that, the idea is that more people will be encouraged to perform CPR. And the way that you do it, and you can actually find videos online, I'm going to give some resources at the end, but what you would do is just put the palm of your hand over the patient's chest, kind of the bottom third of the chest bone, which you call the sternum. Put there firm pressure, put your other hand on top, and then you're just going to compress the chest hard and fast, going about 100 to 120 compressions every minute. And so that can be to the beat or rhythm of your favorite fast song. Traditionally, they've taught the Staying Alive song from Saturday Night Fever, but I feel as time goes on and people get older, not everyone knows that song, especially younger people. So think about, your favorite fast beat song and just do it to that beat. It's almost like 2 compressions each second. So you're going pretty fast. That's really the take-home message. For people that don't know CPR, it's very easy to get enrolled in a local CPR class. If the American Heart Association at heart.org-CPR, they have courses that you can take locally, and you can even watch it online. They have videos online. So if you were to go to heart.org/hands-only-CPR, they have videos, with kind of cartoon diagrams that show you how you can do CPR. And even if you wanted to practice at home, you don't need a fancy mannequin even. One thing that we did as a local initiative to teach people, you can get a roll, like a paper towel roll, put your couch pillow over it and compress on that pillow. That gives you a little bit of what we call recoil, and you can watch that video and practice how to do CPR at home. And so I do think it's really important. There's been a lot of media attention with cardiac arrest lately, with Damar Hamlin at the NFL, Bronny James during basketball practice, can happen during youth sports. Over 70% of cardiac arrests actually happen at home. So if you were to do this, there's a good chance it would be on someone that you know, someone that you love, or it could be, a complete stranger, as was in my case at the airport. But those are really the the basics of CPR and the importance, because not everyone has the same chance of getting CPR based on data currently. And I'd like to change that by getting everyone to know what CPR is, when to do it.
Awesome, awesome, awesome. So that sounds like we're aligned, because we're trying to help 1 million people. And therefore, if we could you imagine if we got 1 million people just to know the basic bystander CPR, we'll be doing big things, right? We will be saving maybe force multipliers in doing this. So just real quick, so you talked about the disparities in care for people administering CPR. I think that is, really important when you said women, because a lot of women have significant disparities in like all aspects of medicine. You mentioned that people are afraid to touch their chest because they potentially could touch their breast. Is there any other disparities, like as far as why is it that Black and Brown people, even in their own communities, are not getting CPR?
Yeah, and I don't know that we know the underlying reason why. Don't know that if it's training, if there's some type of a cultural aspect where people are hesitant to do it, or if there hasn't been training on recognizing CPR, or perhaps a fear of doing something wrong or harming someone. I don't think that we know that underlying reason, but we do know that that disparity exists, and I think education is the way to close that gap.
Good, good, good. And so that's another thing that we need to be a part of research, so that we can figure out what are some of these underlying disparities, especially when you're in your own community. And I probably think it's more associated with fear and not knowing how to do something, and not want to, more than in other communities where you introduce prejudice, bias, racism, and everything else associated with that. All right, so we do have a question. Any caveats with children in terms of how many pumps to breasts?
Yes, typically with pediatric resuscitation, it's 15 pumps to 2 breaths is the standard of what they teach. Little different if it's newly born, but I'll keep it simple with the children. It's 15 to 2. And so another thing with children is that the most common reason why they go into cardiac arrest is due to some type of a respiratory issue or not getting enough oxygen for some reason. Because typically a kid's heart is pretty healthy, and it's a different reason for going into cardiac arrest. So having that focus on their breathing and airway management is another caveat there as well.
Yeah, really good question. And I think one of the things that I'm going to bring up the pillow, since you said I could use a pillow, right? So one of the things I remember learning with children is, depending on what age they are, you're going to use your 2 thumbs right on their chest plate or their sternum, right? And do the squeeze method with that, right? And they'll still be laying down, but you have your hands are wrapped around them so that you can have a flat surface that they're on. So when you're actually doing the chest compressions, that you're actually doing that, right? Yeah,
I have a mug here, but I don't know if I can get that focus on, but it's basically the thumbs around. If this was that child's chest, and then you're pumping with your thumbs if they're a very small infant, and you can fit your hands around. And for the older children where they're too larger than that, you can do the one hand with the palm. And if they're larger, closer to a teenager, then it would be your standard compressions with the 2 hands, like so.
Right. And then what about babies? So like when we learn neonatal resuscitation, I mean, I'm using 2 fingers right over the chest and doing my compressions like that for them.
Right.
The other thing is the mouth breathing. So I know a lot of, but if it's your child, you're going to breathe in their mouth. That's not going to be
absolutely.
But I think also in thinking about that, you said something important. So for children, we start chest compressions first, then call 911 depending on if you're alone or not, or how does that work?
Yes, and so it can be kind of a fine line. I don't want to confuse people, but it is really important to get EMS activated in a timely fashion. So you can start chest compressions immediately, and honestly, like to me, I think it'd be simultaneously, because you're starting compressions and you're getting 911 if you have your phone on you, or you're designating someone to call 911.
Okay. And then also when you're talking about children with respiratory, should you look in their mouth to make sure they didn't like have a toy in their mouth or choke on something? So what about that?
Sure. Yeah, so sometimes choking can happen in children. We don't recommend doing any, we call them blind sweeps, or putting your finger in the mouth to try to retrieve objects, because sometimes that can push it in deeper. But if you are concerned that there is choking, or you witness a choking, if there still, you can do back blows basically. So firm pressure on the back of the back, trying to force that foreign body out. And then if they do go into cardiac arrest, you would do resuscitation in the same way. When EMS arrives, they have tools where they can actually remove a foreign body.
Okay, alrighty. Okay, so when you're out somewhere and it's like, what about the AED? I mean, are we doing the AED anymore?
Yes, we are absolutely doing the AED. And so what you should do, someone's in cardiac arrest, get someone to call 911, so you're activating EMS. The second step in that chain of survival is your chest compressions. When you tell that person to call 911, you're also asking them to get the AED. And so when that AED arrives, there should be instructions on that AED on how to place the stickers. And what an AED does, it's basically a defibrillating device. It will interpret the type of cardiac rhythm that you're in and determine if it's a type of rhythm that could potentially respond to a shock, or what we call defibrillation. So you put the pads on, and there's going to be an audio prompt where that AED is talking to you and telling you what to do next, and telling you to push a button when needed. And so that third step in the chain, so if a person is in a type of rhythm that we call it a shockable rhythm, so there's certain rhythms that respond to shocks and that are a cause for cardiac arrest, the earlier that you can get that defibrillation to happen, the better chance that person has for survival. And that really came up with those recent, sports cases. Damar Hamlin, for example, he had a resuscitation team on the field immediately afterwards. So he got CPR right away. They recognized cardiac arrest, and he had defibrillations on the field. Yeah.
What a blessing. So tell us a little bit more about, so let's just go through a scenario. How about that? All right.
Yeah.
All righty. So let's say we have a 35-year-old, we didn't talk about this, pregnant woman that loses consciousness outside of the Beyonce concert.
Mm-hmm. So I witnessed this. So I see this person collapse. So I'm going to go over, I'm going to say, are you okay? Are you okay, ma'am? Are you okay? And I have no response. So I'm going to look. One way to check for breathing, you can kind of put your ear kind of by the mouth, so you can kind of feel. You're looking at the chest for any chest rise. I do not see any breathing. And so I'm going to call 911. And so now, is there anyone around me?
Nobody around you.
Do I have my cell phone?
You do have your cell phone because it's full of videos.
Okay. There you go. Yeah, because I've been recording everything. So I'm going to get on my cell phone. I'm going to dial 911, and I'm going to put it on speakerphone. So that way I can hear any dispatching prompts from the dispatcher. They may give me instructions on what to do. They may also give me a good timing for how I should be doing my compression. So that can be very useful information. So hopefully it's not too loud, but you can hear that on speakerphone at the Beyonce concert. But so I'm going to dial 911 on speakerphone. And while I'm waiting for the dispatcher to come online, I'm going to start chest compressions. So I have my hand. I'm going to put my palm right on her breastbone. Now, she may be pregnant. How pregnant is she, Dr. Kelly?
35 weeks. This is her baby moon. This is what she was
Okay.
doing. Somebody just up. Her husband got scared, fainted, and then just came back to life. So now he's there with her and able to.
Got it. So he can help maybe talk to that it's on speakerphone, but he can talk to 911 for me as well. And I'm going to ask him if he knows how to do CPR as well, because one thing is that doing CPR is going to make you really tired. After about, a minute or two, I'm in okay shape, but I was pretty tired doing CPR, as you will be if you're doing it. So you're doing compressions. And so, 100 to 120 beats per minute, and we're waiting for EMS to arrive. One hand is over that bottom part of the breastbone, the chest bone, the sternum. So compressions. Some people might be intimidated about doing chest compressions on this pregnant woman, but the fact is that if that mother does not have circulation, neither does the baby. So the more time that they are in cardiac arrest without circulation, the lower chance for her survival. If she doesn't survive, baby doesn't survive either. So important to do CPR.
So if you actually did have two people that knew how to do CPR and they didn't mind doing breaths with the compressions, what's the ratio for breaths to compression or compressions?
Yep. Perfect question. And so husband's there, I bet he wouldn't mind doing, mouth to mouth CPR. So we're going to do 30 to 2, 30 compressions, 2 breaths, 30 compressions, 2 breaths.
Yes, yes. And then we do those in cycles. Is it 2 minutes that you do it for before you like switch off or check the AED or anything like that, right?
Yep. And so while we were calling, we actually notified someone to get an AED as well. And so the AED, we're going to put the pads on, continue compressions. The AED is now going to tell us what to do. It's going to say continue compressions, and then it's going to tell you to stop. It's going to say, I'm analyzing the rhythm. And then it's going to, is it going to tell us to shock, Kelly, in this scenario?
Tell you to shock. And they're not in, she's not in any water. There's no water on the ground. So,
okay. So yeah, so if it tells you to shock, then you want to make sure everything's clear. You want to make sure you're not touching the patient. No one else is touching the patient. The AED should prompt you to check for that. And then there's going to be a button that usually lights up. You press that button and it's going to deliver a shock. And when it delivers the shock, it's actually going to be a jolt. Like the person is going to like visibly jolt when that shock is delivered. So anticipate that. And then after that, it's going to say continue CPR. So you're going to put your hands back on the chest, deliver compressions, and it's going to time it for you when you have that AED on, so that every 2 minutes, you're going to do that again until advanced help arrives. And if you have your 911 dispatcher on the phone before the AED, they will probably be keeping time for you as well, hopefully.
All right. And then just don't be afraid of the fact you're going to have to open her shirt, depending on what you're wearing. So you're going to have to expose at least the top of her chest so that you can put the AED pads on. If it's a male with a lot of hair, sometimes that could be a little bit more difficult, but we rather have them on trying than not. The other thing is always surveying your scene. So if you are in a stampede or a shooting or something like that, you want to make sure you're safe before you try and go help somebody else, although we know you're going to want to be protective. And the other thing is you don't want to shock people while they're in water. So if you can potentially move them out of water, then we want to make sure of that. So the greatest thing about this is, Dr. Whitfield, this is the first time we've actually done a simulation live. So thank you. We know that you are the bomb because you were able to roll with it right with me. So thank you so much. We thank everybody for being on here. You said that you had some links that you wanted to leave. I think you did that. Heart.org, hands only CPR, heart.org /CPR, correct?
Yes, that's right.
All right. And everybody, as you may or may not know, I'm Dr. Kelly OMD, board certified OBGYN and healthcare executive, and here to help you live your healthiest and wealthiest life. If you need to get in contact with me, Instagram at Dr. Kelly OMD or at Viva Life Health Hub, as well as my website is drkellyomd.com. We offer packages for you so that you can actually use the Viva Life 5 to not only save your life, prevent chronic disease, but also save somebody else's. We hope you have a magnificent evening, and a great day. Thank you so much. And don't forget to do what? Viva Life. All right. Thank you for being a part of the Viva Life experience. I'm Dr. Kelly OMD, board certified OBGYN and healthcare executive. If you like what you heard, then please go ahead and like, share, and subscribe. The reason why is because we are trying to educate, encourage, and inspire 1 million people to live their healthiest and wealthiest life. And this is what we're bringing you. We're bringing you educational videos. We're bringing you podcasts. We are bringing you webinars with subject matter experts, including myself, about the topics that affect you the most. So go ahead, like, subscribe, and share. We are everywhere. Have a wonderful day. Viva Life.